A Singapore study has found that recipients of the Sinovac vaccine are nearly 5 times more likely to experience severe symptoms from COVID-19 than those who received Pfizer shots. The study involved about 2.7 million adults who received 2 doses under the National Vaccination Programme. It covered a 7-week period from October the 1st to November the 21st last year. That was when cases in the country surged due to the Delta variant. Compared to the Pfizer vaccine, the study found that Sinopharm recipients were around 1.5 times more likely to develop severe symptoms. However, it found that the Moderna vaccine, that one to be more effective at preventing severe disease than Pfizer. Now, Sinovac recipients were also more than twice as likely to be infected with COVID-19 than those with the Pfizer doses. Now, those who got the Moderna vaccine were also less likely to be infected.
And for more, we have Dr. Calvin Chiew from the National Center for Infectious Diseases joining us now. He's one of the authors of this study. Dr. Chiew, what have we learned about our immunity to COVID, given how differently each vaccine has fared?
Thanks so much for having me tonight. So as we have explained in our paper, we did a relative comparison of the 4 vaccines. But actually all of them, whether they are mRNA or inactivated virus vaccines, they still confer sufficient protection against severe disease. So while we hope that more people will choose the mRNA vaccines because they are more effective, getting vaccinated with any vaccine is still better than not getting vaccinated at all. And that will help us reduce the number of severe infections and reduce the strain on our healthcare system so we can live with COVID as an endemic disease.
Dr. Chiew, this study was carried out much earlier when participants had 2 shots of the vaccine with the Delta variant, which was dominant then. Do you think your findings might change what we know about efficacy in the future?
Well, there are local studies ongoing right now to evaluate the vaccine effectiveness against the Omicron variant and also taking into account the boosters. But so far from overseas, they do show that vaccines are still effective against Omicron, and the booster dose actually helps to enhance protection and actually mitigate the waning of immunity over time.
Dr. Chiew, you mentioned earlier that COVID-19, we are going to treat it as an endemic situation. So your findings from the study, what does that mean for the way how will that affect the way we treat for COVID as it is now an endemic situation?
I think as we move towards treating COVID as an endemic disease, vaccination will still remain a very key strategy. So we have thankfully reached very high population coverage of vaccination, and we should aim to achieve very high vaccination coverage of the boosters as well, and also continue to reach out to the remaining unvaccinated population to get them.
Dr. Chiew, how can we apply what we know so far about COVID to future pandemics?
But we did this study based on the time when it was still 2 doses. And then, of course, research publication takes some time. So we have already used the information to guide policy recommendations, and we have actually moved past this stage. So we have since introduced 3 doses of the inactivated vaccines to be fully vaccinated. And most of our population now has received a booster dose. But nonetheless, I think that this study has demonstrated our ability to analyze a large set of population data to support policy making. And I think we should continue to develop this capability to prepare for the next COVID variant or any future pandemic.
Oh, thanks for that. Dr. Calvin Chiew from the National Center for Infectious Diseases and one of the authors of the study on COVID vaccines.